people are dying from legal prescriptive medication than they are from cocaine or heroin and some of the other things that we call bad drugs.
These drugs can certainly help us. We're living longer and healthier lives than we have in any generation prior. But any drug, even if taken appropriately, has a downside. And when we start misusing and abusing, that escalates quite quickly.
As a person recovering from prescription drug abuse addiction, I think that they're fairly easy to obtain through the doctors, and then I think that what happens is it's very easy to justify using prescription drugs because it was prescribed by a doctor.
This is a complicated issue, and I think it's one of those issues where you might say it takes a village to make a difference.
It's a multi-level problem that we need to address, not just from law enforcement, but from other areas as well.
It truly is incumbent upon us to create the awareness so that we can look to provide solutions.
Hi, I'm J.D. Bickle, a pharmacy student at The Ohio State University.
And I'm Dr. Ken Hale, a faculty member and assistant dean at Ohio State's College of Pharmacy. I work with a learning community on our campus called the Generation RX Initiative.
College is an exciting time in our lives. It's a time of growth, a time to challenge ourselves, a time to experiment and try new things. Unfortunately, more and more college students are taking their lives into their own hands and experimenting with the misuse and abuse of prescription drugs. And as you just heard, the consequences are real and can be devastating. We'd like to take the next few minutes to talk with you about some easy-to-use resources that can help you, or anyone, prevent college students from abusing medications.
We're working to develop and implement programs to raise awareness about this problem and help reduce the abuse of prescription drugs. One of the things we will stress in this brief presentation is the importance of peer-to-peer efforts, and JD is a very good example of how effective this can be. We'll discuss a variety of resources for raising awareness about this problem. These are all available free of charge and include activities to engage college students in discussions about the myths of safety and legality often held by those who misuse or abuse prescription medications. They also highlight the potential health, social, legal, and personal development consequences of abusing these substances.
As Dr. Hale mentioned, many of these resources are specifically designed to present facts about medication abuse to students, and, perhaps more importantly, to engage them in discussions concerning this phenomenon. This is such a vital part of our outreach because, in many cases, college students come to our workshops with preconceived ideas about prescription drug abuse. Yet, by the time they leave, we have seen firsthand how some of these less desirable opinions can and do change. Ultimately, the information we presented was out there all along, yet by simply opening the dialogue about this important subject, students are guided to see and use that information to reevaluate any existing misconceptions about prescription drug abuse. The best way to help reduce prescription drug abuse is to work to ensure that it never starts. For example, I'll tell you about a project I've been involved with around Ohio State's campus. We call it Generation RX and the Abuse of Medications in a Drug-Taking Society. In this one-hour workshop, current pharmacy students lead undergraduate students through a discussion of the reasons often cited for the misuse and abuse of prescription drugs, the consequences of these behaviors, and some general guidelines for safe medication-taking practices. We also include an interactive aspect in some of the programs, using a farming party activity that helps to reinforce the potential dangers of abusing medications. A discussion booklet and facilitators' notes for both of these programs are available on the website for OSU's Generation RX initiative. Students who've attended these programs have engaged very actively in our discussions and have provided positive evaluation feedback.
Our students also provide a skit-based program called Farming to Get By, The Truth About Abusing Prescription Stimulants. This one focuses on the dangers of abusing prescription stimulants, drugs like Adderall or Ritalin, as study aids, a practice that is gaining an unfortunate momentum in both high school and college. The script, discussion questions, facilitators' notes, and slides are available on our website too. We have also prepared a set of bulletin board panels which can be downloaded for use in dorms or other campus settings. It should be noted that while these presentations are an ideal way for health profession or pre-professional students to get involved, others can be effective in spreading the word about these important issues too. Student government organizations, peer educators, and public relations clubs are examples of peer groups that can also make ideal candidates to reach out to their campus communities with this message.
And the list goes on. Ohio State's theater department has a project for social change called Interact, which has partnered with us to produce a dramatization about prescription drug abuse. The use of such skits can really be a powerful way to get this message across and help to put a face to a sometimes impersonal message. Our website contains a recording, which includes a short play performed by this group of theater students. It also shows them interacting with the audience in character, a unique and very effective utilization of their special talents to really make an impression on participants. Supplementary materials for use with this recording include discussion questions, facilitators' notes, and handouts.
The National Council on Patient Information and Education, or NCPI, also provides a variety of resources for prescription drug abuse prevention. One of these is called Taking Action to Prevent and Address Prescription Drug Abuse, a resource kit for America's college campuses. It contains many useful resources providing ideas for campus activities to raise awareness about this issue. Sample newspaper articles and public service announcements, handouts, mythbusters, how to create a Facebook page on this topic, and much more. These resources can be accessed through the Generation RX Initiative or NCPI websites.
So, we have tried to highlight a few of the many resources available that you could use for prescription drug abuse prevention with college students. We especially want to stress the power of peer-to-peer involvement. As mentioned before, anyone can help spread the word about the dangers of medication abuse. Yet, college students are uniquely situated to most easily and openly communicate with their peers, and thus most easily disseminate important information about this public health issue. This problem is real, and it has the potential to cause significant harm, even death. We can all help to reduce this abuse by providing factual information to students and by simply starting the conversation.
We hope you will use these or other resources on your campus to help keep your students safe and encourage the appropriate use of medications. We are very willing to support you in these efforts and can be contacted through the Generation RX Initiative website. Please don't hesitate to contact us with any questions or concerns, or to let us know what you are doing on your campus to prevent prescription drug abuse. Thanks for spending this time with us.
This Collegiate Prescription Drug Abuse Prevention Resources video is presented by the Ohio State University College of Pharmacy with the support of the Cardinal Health Foundation.